Hi everyone, my name is Clodagh Scannell. I'm a registered dietitian and I work in the oncology unit in the Mercy University Hospital down in Cork. I'm also a PhD researcher in the area of cancer and nutrition, working with the Clinical Nutrition and Oncology Research Group, which is based out of UCC. And today, on behalf of Coshnor, I'm here to present on eating well with swallowing difficulties with regards to cancer. And I suppose cancer is not a one-size-fits-all. So the information in this video is very general. It's for a very general oncology audience who may be experiencing some swallowing difficulties. So the information should not precede, I suppose, any information that you've been given by your oncology team, by healthcare professionals who know you personally. So swallowing difficulties, they're really common in cancer, particularly in the head, the neck, the throat, or even in the upper GI, so maybe something like an esophageal cancer. And that can be because of where the tumour lies or because of some other kind of aspects of the cancer that's impacting on eating and swallowing. So when we have this kind of difficulty in chewing and swallowing, well, the medical term for this is called dysphagia. And dysphagia can kind of result in foods essentially going down the wrong way, as we would call it. But what we mean by this is that they end up in the lungs rather than the stomach. So food is going down wrong and ending up in the lungs. So when this happens, and if this keeps happening, we can get chest infections. So and then the chest infections can be kind of unexplained, or they can kind of keep happening, kind of recurrent. So what we do to help with this is we can modify the consistency of food, or we modify the texture of food. So when we have cancer or we're going through treatment, good nutrition is really, really important. It's going to help maintain your energy, help you to deal with the side effects of treatment, deal with the fatigue. It'll help support your immune system. It'll reduce the risk of infection. Your tolerance to treatment will be better. You'll recover faster from your treatment. But because of cancer and because of treatments, sometimes the way in which we use the food we eat has been altered, so our metabolism changes a little bit. So sometimes we need more food because our body isn't using it as well as it should be, because it's I suppose, using it elsewhere. So if we're not eating enough food, or we need more food and we're still not eating enough food, this can result in weight loss. And keeping your weight steady during cancer treatment is one of the most important things that you can do. So the guidance says that even if you are overweight while you're going through cancer treatment, now is not the time to be losing weight. The priority is to keep your weight steady while going through cancer treatment. And if we put, I suppose, if we think of treatment, sometimes we're nauseous, sometimes we have a poor appetite, sometimes we might have issues with our bowels. It can be really hard to eat a normal amount of food, and then because of cancer we need more food. So it can be really challenging. And then if you throw a swallowing difficulty in on top of that, it can be very challenging to get the nourishment that we need. So I would urge you to speak to a dietitian. A dietitian is the only healthcare professional regulated by law in Ireland that's able to assess, to treat, to diagnose someone who is vulnerable, who is unwell, who is sick in hospital. So they're the only healthcare professionals that deal with nutrition in a hospital setting, and that's where you should be getting your advice from. So with that then, it's really important that you monitor your weight. So as I said, the aim is to keep your weight steady throughout treatment, even if you are overweight. So you might go to your oncology unit and you might get weighed, say every 2 weeks or every 3 weeks, maybe every 4 weeks, depending on your treatment plan or your chemotherapy. Keep a note of those figures. So it might be a different nurse, or they might not look back in your medical notes and see that there's a trend of you losing weight. But if you have the figures yourself, you'll be very well informed. If you don't get weighed, maybe you're on immunotherapy, then keeping a track of it at home, maybe borrow a scales, or maybe going to a pharmacy, or you might have a scales at home, and keeping track of your weight. So the best time to do is when you get up in the morning, light pair of clothing, after you've gone to the bathroom. That's when you're going to get your most accurate weight, and maybe doing it once a week or maybe once every 2 weeks, and then you'll notice the trends yourself. And if you are losing weight, speak to your oncology team. So what are some signs that you might be experiencing dysphagia or a difficulty in swallowing? Well, you might be getting, as I said, kind of frequent unexplained chest infections. You might find that you are coughing, or that you're actually physically choking while eating. This could be while you're actually eating, it could be after the meal is finished, and you're unexplained coughing. There could be the feeling of food kind of getting stuck in your throat. or as I alluded to before, foods and drinks kind of essentially going down the wrong way, which can be very unpleasant. Some people get kind of like a wet sound or a gurgling sound to their voice after eating and drinking, and this because the food and drink has not been cleared. You might find then that you're actually just moving food around in the mouth, and it's very difficult to actually coordinate it to swallow. So you could find that it's taking longer, or that food is kind of being left over in your mouth even once you have swallowed. You may be experiencing kind of frequent heartburn or indigestion because of undigested food in places where it shouldn't be. You might find that you're eating slower, you're really struggling with your meals more, even if you're having a smaller meal that you're struggling, or you may be experiencing unexplained weight loss. So if any of these apply to you, I would bring it to the attention of your oncology team and ask to speak to a dietitian, but more importantly, a speech and language therapist. So a speech and language therapist, what they do is they can prescribe a textured modified diet, and a speech and language therapist is the only person who is able to do this. So they will assess you, they will get you to swallow some foods, and then they can prescribe you a diet that's based on your ability. So there's kind of 4 main types of diets. So there's kind of a soft diet, there's a minced and moist, or there's a smooth puree, or there's a liquidized diet. So the diet that you're prescribed, as I said, will be based on your ability. And these diets, they should meet all your nutritional needs. But as I said before, in cancer, your nutritional needs are higher than previously. So you might need more food. But if it's a texture modified diet, if they're not well planned, they can be really low in energy, they can be really low in protein. So once you have your prescription from a speech and language therapist, it's really important to link in with the dietitian who can help you make a personalized plan based on that consistency. So these are just some general tips for adding nourishment to a texture modified meal. And again, this is just for a general audience. You'd need to speak to a speech and language therapist to get your own kind of diet personalized for you. So there's lots of things that some people might be able to have, but other people might not be able to have. So as I said, this is very general. But adding butter, adding cream, adding cheese when mashing and blending foods is a really good way to add moisture, but also to add nourishment like calories, which are the energy we get from food, and protein. If you're having something sweet, something like a seedless jam, so emphasis on the seedless, or honey to porridge and breakfast cereals, or maybe a smooth yogurt is a really good idea. You could add kind of butter or mayonnaise or soft cheeses to mashed potatoes and cooked vegetables. That way you're kind of making the most of every bite. So another one then is full fat dairy products. So if you've been consuming, say, your semi-skilled or your low fat milk, now is a good time to swap to the full fat varieties. So drinking milk is a really good way to get a nutritional or a nourishing fluid into you. You could add kind of a grated cheese to maybe potatoes, to soups, to pasta dishes. Protein then is, I suppose, a really key nutrient that we should be focusing on when we have cancer, because protein is the building blocks of all our muscles, and we should be having it at every single meal. So be that something like a hard-boiled egg, or dairy products like full-fat cheese, milks and yogurts, meat, fish, poultry. Again, your speech and language therapist will let you know if you can consume these foods or if you need to mash them or to blitz them down. Eating every 5 to 6 times a day, maybe every 2 hours, is a really good way to make sure that we're constantly topping up our stores and keeping ourselves replenished. Three meals, say your breakfast, lunch and dinner, as standard. People can find that can be quite difficult, and then there could be long gaps between meals. So breaking it down to 5 to 6 smaller portions maybe are more frequently. So here I've just touched on maybe some foods to avoid. Again, this is not a one size fits all, so it might not be suitable for everyone, and the team that know you personally will let you know. But what some people find, that kind of stringy fibrous foods such as like celery or cabbage, or maybe like a lettuce, or like the oranges, can be quite difficult to swallow. Something that maybe has like seeds, like grapes, or little small mandarin oranges, they can be quite difficult to swallow as well, and they pose kind of a choking risk. Some people struggle with maybe mixed consistency foods, so maybe that's like soup with like large lumps in it, or maybe like a breakfast cereal where you've kind of soggy lumps, and kind of like the liquidy milk as well can be quite difficult, the different consistencies. Rough, crunchy foods, so like crackers, crisps and nuts, could be best avoided as they also pose a choking risk. And then like a hard-boiled sweet, maybe like a chewy sweet like a toffee, they can be hard to consume, you know, on the regular. So if we have a swallowing difficulty, they might be something that's best avoided as well. So some top tips, I think, for just having that kind of safer meal environment would be, when you are eating, to sit upright, to sit at a table, you know, to have your elbows not resting on the table, you know, creating good posture can help things go down the way that they should. Remain in that position for like 30 minutes post dinner, just as I said, giving everything the chance to go down the way that it should. Eating while lying down can make things really difficult, and it can increase your choking risk. And similarly, maybe not lying down straight away after your meal, maybe giving it, if you 2 to 3 hours eating before going to bed. This might be a difficult one, but try not to talk or to talk while eating or drinking. Just really give it your full concentration. Similarly, take small amounts, go slowly, enjoy your meal, enjoy being, I suppose, in good company if you are, and not to rush your food, because you're only going to increase your risk of choking. And swallow twice, so like eat your food, swallow, and then swallow again, making sure that everything has been cleared from the airways. So myself and a team of dietitians in University College Cork have actually devised a lot of evidence-based information resources for people who have been diagnosed with cancer. So they're freely available on Breakthrough Cancer Research. If you want to log on there, you can access them. But we've also devised a range of cookbooks, and there's 4 cookbooks, and they are for each individual, I suppose, texture modified consistency level. So we have one for level 3, which is your liquidized diet, one for level 4, which is your pureed diet, level 5, which is minced and moist, and then level 6, which is your kind of soft and bite side. So these should be available in your oncology unit. So ask your dietitian if there is one available for you.